When it comes to oral health, we're not very good when it comes to advocacy. So we decided at this meeting, we're going to talk about advocacy, and we wanted to figure out, is there any evidence that could inform advocacy? The interesting thing with this meeting was that we invited people outside of oral health as well. We recognized that we cannot do it on our own. We need people with other experiences. We needed people who could tell us how to interact with sections in healthcare and even outside healthcare that we haven't even addressed before.
Over 3.5 billion people in the world have dental disease, decay, gum disease, and oral cancers. Yet we've known for over 50 years basically how to prevent oral disease, but we're still using an old model of fixing things.
So we have pulled together, curated people from all over the world here today to look at the problem, identify the problem, because it differs in every country and everyone brings a different purview. And then the plan is find the right solutions and then deploy them to really elevate people from the bottom up.
And it's very thrilling to sit here to see the people that have been assembled and the level of discussion.
It's very interesting to be part of this discussion and to look at ways that we can learn from each other in terms of how we advocate for oral health. How do we actually make sure that when we talk about health, we're talking globally and we're talking about all areas that could be relevant? You have to bring people from different backgrounds and diverse skills and culture to participate on this discussion.
It's just wonderful to have so many individuals not associated with oral health directly speaking about the advocacy that will be necessary for issues of oral health, health for persons with disabilities, how to manage disinformation in our society today.
I think we're in this time now where science too needs to do advocacy. We need to find ways to get our research into the hands of our beneficiaries, the communities we care about. We need to be smart. We need to have shared tactics and shared goals for really One Health or improving health.
Really trying to elevate the voice of people living with non-communicable diseases, making sure that we've got strong patient advocates, and really the mantra of nothing about us without us being really relevant to our community and our response, so that when policies are being developed, when health services are being designed, when programs are being monitored and reviewed, that we always have people living with NCDs and oral health conditions at the table and are involved.
Well, certainly we have a global oral health problem with so many people suffering from oral health diseases throughout the world. But if you think about the broader population, if we engage people throughout the world to advocate for themselves, to advocate for better oral health, how powerful the message will be.
Community engagement initiatives that are focused on oral health should always come from those community members. As we think about what's most important to community in terms of defining what good oral health is, we need to ensure that those initiatives come out of the community and that we're supporting them both from a resource perspective as well as a people and brain power perspective.
We always need to put patients into the center of all the work that we are doing as a global community, right? So together we have a stronger voice, and together with the patients as well, we can then hopefully advocate for better global oral health and local as well. When we look broader, countries still collect data on paper. Very often the information that we have at hand is quite old or outdated. So there are challenges, but there are also very good means already, may be, for example, mobile oral health applications, but also other digital tools which can be used in very low-resourced settings. So I am very, very optimistic that using the tools and also technologies that we have at hand, it is essential and important, and it is possible to really improve the local level or the national level planning for oral care.
I believe that data is essential. I'm a scientist, and unfortunately, we don't have large amounts of data on successful programs. And so one of the learnings in trying to gather all that data to make the argument is that we need to really coalesce with all the experts to determine what are the key performance indicators, what projects or initiatives really work in different communities. No matter how much we do from academia or industry to help, government programs are what are going to make it sustainable, and the governments really need that data.
Evidence is critical, but getting it into the hands of governments, political leaders, champions to really make sure that action is sustainable and that more resources are going into these issues.
We're not just talking about academic studies. We're talking about how to actually make something happen. And that's what's been missing in the oral health arena for many years, is taking the policies, taking the decisions that need to be made and figuring out exactly who do you have to see, who do you have to convince, and how do you actually make action happen in a particular forum. As governor of Kentucky, I implemented the Affordable Care Act and expanded Medicaid in Kentucky. We did that by gathering economic data of how important doing those things would be for the Commonwealth of Kentucky. And so that kind of evidence is very important to decision makers, particularly political decision makers. We know what needs to be done. It is now time for us to figure out how we take that and turn that advocacy into making something actually happen and delivering this kind of healthcare for the people all across the world.
If you want to change things in dentistry, you have to do them through public policy. Like if I can get fluoride into one water supply, I can do more than sitting my whole life chairside filling teeth. I want to create a center for integrative global oral health, a policy center to start enacting some of the things we know that will prevent disease.
The Center for Integrated Global Oral Health plays a key role in facilitating these types of conferences that promote the level of discourse that we need to have in bringing oral health to the table.
You cannot have health without oral health. But we need to make that message very clear to the people who are in charge of sitting around the table and discussing health.
The big goal is to integrate oral health back into general health where it belongs. I mean, you don't divide people at the neck. And the things that cause oral disease also cause the other non-communicable diseases. So we have to solve all these health problems together. Our big hopes for changing not one life at a time, which is what we would both do in practice, but thousands, if not millions of lives as a result of this, of the activity of the center.
Go bigger, billions.